Classification of strabismus. Strabismus could be false or pseudo or apparent, where there is no actual strabismus, or could be true. True could be latent or heterophoria, which is a hidden form of strabismus, or could be manifest or heterotropia. And manifest strabismus could be comitant or concomitant, or incomitant or non-concomitant. Incomitant strabismus could be paralytic or restrictive. Strabismus could be also convergent or esodiviation, divergent or exodeviation, or vertical or hyperdeviation. Apparent strabismus or pseudo-strabismus or false strabismus. It's a false impression of ocular deviation, but the eyes are straight, or orthophoria. There's no manifest strabismus and no latent strabismus. The eyes are straight, and the image falls on the fovea in each eye. It's only that the patient has an appearance of strabismus, but he has no strabismus. It's diagnosed by a central corneal light reflex, where the corneal light reflex lies in the center of the pupil in each eye, and there is no movement on cover test. Types and causes of apparent strabismus. Apparent esotropia due to epicanthus, as seen on the small baby picture, or a narrow interpupillary distance where the two eyes are close to each other, so gives the appearance of esotropia, or in cases of high myopia. Normally, the visual axis crosses the cornea on the nasal side of the optic axis. The visual axis is seen in pink in this picture, and the optic axis is seen in yellow. The angle between the visual axis and the optic axis is called angle kappa. When the visual axis crosses the optic axis on the nasal side, angle kappa is positive. In high myopes, due to growth of the back of the eye or a posterior staphyloma, the fovea is shifted nasal to the posterior pole, to the middle of the globe posteriorly. So the optic nerve and the fovea both lie on the nasal side of the optic axis. As the visual axis joins the object of fixation to the fovea, now the visual axis lies on the temporal and not on the nasal side of the optic axis. When the visual axis lies on the temporal side of the optic axis, angle kappa becomes negative. This occurs in high myopes. So to focus on the object, both eyes have to converge. So the optic axis moves nasally in both eyes, and this gives the appearance of an apparent esotropia. So high myopes have apparent esotropia, which is false, not true strabismus, because the image still falls on the fovea in each eye. The second type of apparent strabismus is apparent exotropia, or apparent divergent strabismus. It could be due to a wide interpupillary distance, where both eyes are located a bit far away from each other, or in cases of high hypermetropia. In high hypermetropes, the visual axis still crosses the cornea on the nasal side of the optic axis, like in emmetropes. However, as the eye is short, there's a small axial length, the angle between the visual axis and the optic axis becomes bigger than in emmetropes. So to focus on an object, both visual axes have to move outwards a large distance. So the optic axes move outwards as well, or diverge, and this gives the appearance of an apparent exotropia. But actually there is no strabismus because the image falls on the fovea in each eye. As in this boy, both eyes are divergent, but the reflexes are symmetrical. So this is a form of an apparent exotropia or a false exotropia, not a true one, due to a large positive angle kappa. This girl also has appearance of an apparent exotropia due to wide interpupillary distance and a positive angle kappa as well. So diagnosis of apparent strabismus is by finding the cause of apparent strabismus, for example, epicanthus, and the corneal light reflex lies in the center of the pupil in each eye, and by cover test there is no corrective movement because the eye is straight. As it's not a true strabismus, so there is no treatment because this person is a normal person. So there is no treatment for apparent strabismus because there is no strabismus. Back to our classification, we talked about false or pseudo strabismus. Now we are going to talk about true strabismus. The first type of true strabismus is latent strabismus or